Yes, it is indeed time for Ask the Experts, and we have the best expert I know, Dr. Barry Lycka. Thanks for joining us today.
Thank you, Jason. Glad to be here.
Well, it's great to have you. Today we're talking about rejuvenation. We're talking about injectables. You've got a lot in this book right here. You can check it out. But my question to you is, what are injectables?
You know, injectables are anything we put into our face by a needle. And there's two groups of injectables. The first group is what everybody probably has heard about, Botox and Botox-like substance. We call them neuromodulators because what they do is they block the signal that goes from a nerve to a muscle. And by doing so, we stop some of those ugly things of facial expression. You know, one of the ugliest things most people have is the two goalposts between their eyes. We call them glabellar creases. Now, what does that mean? I mean, these are the number 11s, the 11s that go in from frowning, from snarling.
Yes.
And what happens is as you do that perpetually, these thinking lines start to put a crease in that area. It makes a person look angry. It makes a person look snarly. But another area that's ugly are the area around the eyes called crow's feet. Now, I have no idea how they got the name crow's feet, but they're ugly. And most people do not like those crinkles there. They'd sooner have them look nice and young. And all these things basically give us an impression that we don't want to have. We give it the wrong impression. Now, the second group of injectables are what we know as fillers. Fillers are things that we put underneath the skin to help plump it back up. And unfortunately, as we get older, the number one thing that happens is our face starts to inflate. We start to look like a balloon. Our balloon starts to fall away a little bit. And that's just a normal part of aging. And it hurts us, and it makes us look sallow. It makes us look older. So we can now reverse that through materials called fillers. And the prototype filler was one used years ago called collagen. Collagen was a material we put into the skin, but it didn't last long. It caused allergies. So it was replaced by a group of substance called HA, or hyaluronic acid. And there's many, many of those out there. In Europe, there's over 700 different HA products. In Canada, we probably have about 24 of them. And they're little substances that we put under the skin to make them look better. For example, if your lips are getting thinner as you get older, you know, as we get older, we're all going to look like that. So what we need to do is put those lips back. And those lips we can really make look nice in this day and age. We can also get rid of the folds around the mouth and make them look younger. Our cheeks will start to fall, so we can help put that back. We can put the jawline back. So all this is done with filling substances. Now, this is really an art. It really takes a fine hand to do it right. It really takes the right knowledge of it. It's not something that everybody can do. So I advise the consumer when they're looking around to check out a person's credentials. Make sure that they know what they're doing. Make sure they educate other people. Make sure they teach about it. Make sure they speak on the podium. Make sure they know about it. That way you'll be certain that you're getting one of the best. It won't guarantee you have a perfect result, but it'll give you a better chance at getting it. It's very important that the consumer look around, check things out, because, you know, there's a lot of people that say they do these things, but they don't walk the talk and they don't talk the talk. Those are important things, I think, for everyone.
Now, it's interesting. You keep saying we, as in we have these issues with our face. So I thought this was mainly more used by women, but is it men are using this as well? You
know, when I first started, I used to see one man for every 100 women. Now it's about 10 to 1. So men have these issues too. You know, as you're getting older, it's harder to fight for a job if you're looking old. It's harder to make a sale if you're in the sales department. It's harder to look like the head of a corporation if you look like you're 90 years old. They think you're past your prime and should be put out to pasture rather than stay in the field that you're in. So I think it's very important that people look the way they can. You don't have a second chance to make a first impression.
So you find that this actually was one of the benefits would be boosting self-confidence?
I think self-confidence is what it's all about. I think everybody needs a modicum of self-confidence. They need a lot of that. They need to know how to look good and feel good. And I think this is what it does. It gives you that advantage. It gives you that edge.
Now, quickly, how do we know which one is right for us?
The best way is to choose your doctor. You know, the doctor is the #1 choice of what you need to do. choosing your doctor, then they'll help you make that decision. And a good doctor will help discuss this with you. They'll help to tell you about the benefits, and they'll show you what you need. And they'll give you a good idea about what can happen if you get these procedures done.
Dr. Barry, Lycka, thank you very much. We love having you on.
Thank you very much. My pleasure.
All right, we're going to take a quick break here on Dinner Television. Lots more still to come. Stay with us, Edmonton.
This portion of Dinner Television is brought to you by Dr. Barry Lycka, MD.